Joe Biden says that he has a plan to address a pandemic crisis that has to date claimed the lives of almost 190,000 Americans, 20,000 more than were had during the virtual Democrat Party nomination convention. Over 2,600 of those lives were residents of Virginia, and over half were the elderly in nursing homes, a known risk from the very start. And he claims that the president does not have a plan. He claims that if the nation only agreed to elect him, he could solve the crisis by simply having everyone, infected or not, be mandated to don a facial covering. He could solve the problem of the pandemic crisis in just 3 months. But only yesterday, the Centers for Disease Control found a need, an urgent need, to publish revised guidance on facial coverings, graphically illustrated with cartoon figures to demonstrate failures in public education that have left persons unable to comprehend the concept of a respiratory tract infection, who have fashioned from their own understanding novel ways to wear a facial covering, regardless of its alleged protective properties, and who have failed to cover their noses and their mouths, the only way in which a respiratory tract infection can enter their bodies. In the beginning of a pandemic crisis, one medical research service at Oxford University fatalistically concluded, if readers are confused by the mass of contradictory information, so are we. What can be desumed by this post is that no one really knows what is going on, least of all governments and professional associations, which seem at odds with news outlets as to how many of their members have died. As our grandfathers used to say, when you do not know what is going on, do nothing. This is what we plan to do from our privileged position: observe and monitor the situation without jumping to conclusions. And yet, while a soldier can tell you that the worst thing to do in an ambush is to decide to do nothing, the worst thing to do when a grenade has lost the spoon and the safety, and you have 5 seconds and 3 are gone, the worst thing to do is to do nothing. Just days ago, in a weekly live stream update, Ralph Northam, a former Army surgeon and the nation's only licensed and practicing physician currently serving as a state governor, appeared not even able to define nor communicate what it means when a pathogen is airborne and being primarily transmitted as an aerosol. And it is easy to despair when it appears that even the scientists don't appear to know what is going on. Some simply say that it is what it is. But in one national tragedy, where failure was not an option, that has become a popular movie, the hero and protagonist gave this advice: work the problem. Work the problem, gentlemen, and we can bring our boys back home. That protagonist made a decision that no American astronaut had ever died in space, like they had under a communist regime. And no American astronaut was going to die in space on his watch. So, ladies and gentlemen, let's work the problem. In 2010, the National Institute for Occupational Safety and Health, NIOSH, performed an extensive study using the same technical apparatuses that the NTSI International uses to rate the effectiveness of medical-grade personal protective equipment, like the N95 mask, to determine if there might be a homemade substitute that could be provided to the general public so that they could preserve medical-grade PPE for essential workers like those engaged in public health. And they empirically and clinically determined that there existed absolutely no substitute. Your bandana, your gaiter, face shield, scarf, or hand-sewn mask cannot block an infection from a microbial particle measuring less than 5 microns, no matter how many times you fold it. It simply is what it is. It's like a science. In 2005, the Journal of Occupational and Environmental Hygiene concluded that regardless of whether medical researchers standing in the dark and screaming healthy can't see laser illuminated particles when they scream healthy through facial coverings in the dark, as much as 10% of the potentially infectious pathogens that you exhale are still able to penetrate the facial covering that you have been mandated to wear by law. But their greater concerns, were as obvious as your fog of glasses on your masked face, that those particles that flow out from the sides, primarily in the form of aerosols, pose a greater risk of delivering a potentially infectious particle or particles into the breathable air of others. Bottom line, if everyone was fully compliant with the Biden Northern mask mandate plan, clinical researchers long ago still yet determined that that does not work. It simply is what it is. It's like a science. Yet through powers of observation, what we can see is that America has become the leader in fatalities, while the other nations appear to be getting the pandemic under control. And a reasonable person would propose the question, if donning masks is not the reason why other nations appear to be able to control a pandemic pathogen, how are they apparently succeeding where we have woefully failed? And that answer is in the science. Most regrettably in the science that the nation's only doctor serving as governor decided to ignore. Like Joe Biden, Ralph Northam early began to promote a mask solution that science has known would not work for over a decade. And that is a plan endorsed by Senator Mark Warner and Don Beyer. That answer is in the science. Most regrettably in the science that the nation's only doctor serving as a governor decided to ignore. Like Joe Biden, Ralph Northam has decided to control a pandemic pathogen out of control by identifying infections in the population by extensive testing, attempting to locate a very dangerous needle in a haystack, a very large haystack, to trap and eliminate a pandemic pathogen, which by definition can present at any location or in any person in the world, while choosing consciously to ignore trace contact follow-up, which even the Chinese did in Hubei province, dispatching an army of epidemiologists in teams of 5 to perform thousands of trace contact follow-ups per day. And apparently, the reason that he chose to ignore this basic infectious disease control measure was because of the findings that were found by those professional teams in China. They could not find a person-to-person infection rate in China that exceeded 5%, despite finding a high case infection rate, which scientists measure with what is called R0, but which even the CDC advises against as a measure for person-to-person infection rate because it is entirely subjective and vulnerable to manipulation by unscrupulous people especially. That answer is in the science. Most regrettably in the science that the nation's only doctor serving as a governor decided to ignore until days ago. A novel coronavirus is being transmitted not person to person, but as an aerosol, primarily. While Governor Northam had problems describing that concept, medical researchers describe that state in an exhalation event, be it a cough, a sneeze, or talking, by saying prior to the evaporative water loss that these particles undergo, many particles are sufficiently small to remain suspended in air for several minutes or more. In addition, owing to evaporation, some fraction of the larger particles become sufficiently small to remain suspended in air for a similar duration. If particles carrying pathogens are inhaled by a susceptible individual and deposit in the suitable location in the respiratory tract, infection and disease can ensue. Susceptible persons include personal contacts of the diseased individuals and healthcare workers who attend diseased patients in institutional settings. And using the science, you have nothing to fear but fear itself, because simply the presence of small infectious particles in the breathable air, whether as published in National Geographic, a droplet can fly over 26 feet, or as reported by CDC, a particle can bounce off a sheet in a hospital bed and deposit itself on the other side of a room or under a bed, because an infectious dose or critical mass of pathogen must be delivered to the entrance of your mouth or nose sufficient to overcome your natural immune defenses. And to date, that level of viable pathogen, that critical mass, has been found on no contaminated surface for fomite infection, nor in the breathable air in any setting where an infection has occurred. But where an aerosol transmission has been confirmed, the pathogen was in sufficient mass for only less than 2 hours from what scientific studies have been able to deduce. And if no person had that sufficient viral load inside him or her to produce an infection in others, especially in mass super spread events, that saturation event had to be induced by some unnatural cause introduced to that environment. A theory that Senator Warner has ignored since March after receipt of an intelligence estimate, and a theory that Governor Northam has evaded in court in obstruction of justice since the beginning of April. And that simply is as wrong as two left shoes. My name is Major Mike Webb, and I am running for Congress. With liberty, honor, and excellence, by God, we shall make America great again. Honest. This advertisement was authorized by Mike Webb.